So every patient is different. I've had a patient jump off the table and say, "That was awesome, can I leave?" And I've had patients sitting with an ice pack on their head and maybe take a half of a Vicodin. We do offer them pain medication. We have a variety, including a double lockbox that allows us to have narcotics. So we can offer them strong pain medication if they need it. I would say about 50% of patients may take something a little bit stronger than Tylenol. Patients are told that in advance, that we do have pain medication if they need it after, that they can stay in the office as long as they need to, that they don't need to bring somebody to take them home, which is another big advantage of doing things in the office setting. Some people will choose to anyway because they're not really sure how they're going to feel, but we'll sit with them and until they're comfortable. Maybe give them some juice and some cookies until they're able to leave.
It's been 2 weeks and 1 day, and by about 12 hours after my procedure, I was doing pretty well. By the next day, my headaches had gone down and I was back to work. After about 3 or 4 days, I feel like my breathing was improving. It felt wider. I know if that kind of sounds weird, but I could breathe up my nose, which never really happened, especially on the right side. I never was able to do that. So I do feel like every day the breathing is improving. And even with the season change and the pollen, I'm not having congestion, maybe some runny nose, but that's with pollen. But as far as breathing, I do feel like it has definitely improved. I knew for years that I had really narrow sinus passages. I've had this before. I was sick in college. I've gone through this type of stuff. And I always avoided it because I heard horror stories of being out of work for 3-4 weeks. And I really wasn't ready to do that. And I didn't really want to be out of work for that long. So when she approached me with this type of surgery, I thought this might be a less invasive process. And it might really, why not start with the least invasive and see if it really improves you? And so far, I'm happy with it. The navigated balloon procedure, it was the least invasive process for me to feel better. And I was awake and I was conscious and I felt like it was fast. It was the fastest procedure I've ever had, which is really nice. And I was back to work the next day. So I would recommend it, yes.